In this week's video, we are looking at canker sores, and the truth is, 1 in 5 of us have probably had a canker sore at some point in our lifetime. Now, if you're watching this video and you're thinking, what on earth is a canker sore? Well, if you're here in the UK, we call them mouth ulcers. So, what we're going to learn is we're going to learn about canker sore treatments, or mouth ulcer treatments if you want to call it that, and you're going to learn how to get rid of those canker sores, because I know they're uncomfortable and painful. So this is going to be the video you need to watch. So welcome to my channel. If you haven't been here before, we talk about everything medical and healthcare related, but most importantly, we always look at the evidence. All of the information on this channel is evidence-based, so it's scientifically backed, so you know you can trust all the information that we give. Also, please don't forget, if you've watched this video and at some point in the video you think, you know what, I found this video really interesting, I found it really helpful, I didn't know that, I learned something new, then please don't forget to click that like, because it's going to help me and it's going to help the video grow. Lastly, before we begin, please remember all of my videos are chaptered, so if at any point you want to find any specific piece of information, then feel free to click on that description and click on the relevant chapter. Okay, so let's begin with the basics. First of all, what is a canker sore? Well, a canker sore is a small little ulceration that usually happens within the mouth cavity. It can be anywhere along the gums, it can even sometimes be on the tongue, and they're usually a small little ulcer, like I said, and they're usually white or grey in appearance. They can be incredibly painful, however, and that's probably the worst thing about canker sores. Most people get them, like I said, 1 in 5 of us will get a canker sore at some point in our lifetime. It's not usually a sign of any health conditions or you being unhealthy. Anybody can get them. However, if you are getting continuous canker sores and it's happening constantly, sometimes this can be related to certain autoimmune conditions. For example, Crohn's is one of them, but autoimmune conditions can sometimes increase the risk of getting canker sores, so please do bear that in mind. Now, I'm sure you'll be relieved to know that canker sores cannot be spread, so they're not infectious. It's not like the herpes simplex virus, like cold sores, that you can spread it to other people from kissing or anything like that. However, it is always good to bear in mind that it's difficult to tell. Sometimes it might not be a canker sore, it might actually be a cold sore or something else. So until it's fully relieved, it's probably best off just to stay away from kissing and all that sort of stuff, just to prevent it from spreading, just in case it's not a canker sore, if that makes sense. Okay, so background done, now let's get straight into it. Let's start with tip number 1 on what you need to do for canker sore treatment and how to get rid of mouth ulcers, canker sores, whatever you want to call it. Tip number 1 is going to be my easiest tip that everyone can do at home. I'm going to start with these tips to begin with, actually, home sort of treatments that we can do, and then we'll talk about medicines and stuff like that you probably have to go out and buy. So, tip number 1, you need to make yourself a salt water rinse, okay, or a salt water mouthwash. This is going to be really good at reducing the inflammation in the area and also preventing it, reducing the risk of it getting infected or getting any worse, to be quite honest with you. So, to make it, it's really simple. Boil the kettle, let the water cool then, get yourself a mug or a glass or anything like that, put yourself a teaspoon of salt. You can put half a teaspoon of salt, you can put a teaspoon of salt, it doesn't really make any difference. Whack that in, pour the water in, give it a good stir, and then let it cool. You don't want to be doing it with boiling hot water, okay? So let it cool, let that salt dissolve in, let it cool, pop yourself over to the sink, because this is the messy bit, and use it as a mouthwash, okay? Once it's cooled, rinse it around the mouth as much as you want, and then spit it out, okay? Try not to swallow it. It's not going to harm you if you swallow it, okay? But try not to swallow it. You don't want to be swallowing all that salt in a watery solution, so try and spit it all out. And afterwards, when it's done, just give your mouth a quick little rinse with water, okay, just to get any of that salt residue out of there. This is going to give us symptomatic relief, and like I said, it's also going to help prevent it to some extent from getting infected or worse or anything like that. It's always good to do it, just increases the hygiene and it gives you that symptomatic relief. You can do it as often as you want, okay, because it's often a question that I get asked from patients. How often can you do it? You can do it as much as you want. There's no maximum on how often you can do this, so do it as much as you need for symptomatic relief, but don't forget to just give it that rinse out afterwards. And please remember, if you do want more information on making the salt water rinse and all of that, I will explain it more in the description below. So let's move on to tip number 2. Tip number 2, now we're going to look at over-the-counter treatments for canker sores, okay? There are tons of different products out there, so I'm only going to go through the ones that have the most evidence supporting them, okay? And in terms of OTC, over-the-counter treatment, that's just short for OTC. In terms of OTC treatment, we are looking for 3 things really. We're looking for pain relief, which is probably the main thing. The next thing we're going to look at is recovery time, and it hopefully increasing, reducing the recovery time needed. And thirdly, possibly trying to prevent infections and it getting any worse. So that's the 3 things that I really want from the OTC treatment, and that's what we're going to go through, the best ones for doing that. Okay, so probably one of my favorite products that I recommend quite often to my patients for a canker sore is chlorhexidine mouthwash. mouthwash. I do like this one in particular because I feel like it really does help reduce the pain. It also helps to speed up that recovery time, and it helps reduce the rate of infection. Chlorhexidine mouthwash, for example, is also used for different things as well. For example, it's used to prevent gingivitis, gum disease, that sort of stuff as well, but it can be really helpful with canker sores too. So you can get this from any chemist. Follow the instructions on how to use it. Obviously speak to your pharmacist as well, at the chemist, just to make sure that you're safe and suitable to use it. But in terms of using it, I find chlorhexidine really, really strong, and sometimes it can really kind of take the taste away, your sensation of taste, for at least a couple of days until your mouth sort of gets back to normal. So one way to prevent this from happening that I like to do is, it will come with a little cup. I don't have a little cup to show you, I'll just show you this lens cap. So imagine this is your cup. What I would do is I'd fill the chlorhexidine halfway, and I'd fill the rest with water, okay, just some normal tap water, and then use that as a mouthwash, okay, and then follow the instructions for how many times that you need to do it. But it's a really effective way of just reducing the intensity of it, because it's really strong stuff. So like I said, as soon as you use it, you're probably going to lose your taste for a couple of days. So bear that in mind. If you do my little dilution method, it's going to reduce the chances of that happening quite a lot. But it's really good with regards to canker sores. Now, another mouthwash which is quite effective as well is benzidamine mouthwash. This is generally a lot more expensive to buy. Again, it works similar to chlorhexidine. It does actually taste a bit better as well, and it's not as harsh in the mouth. And like I say, it has a similar effect to the chlorhexidine. It helps speed up recovery time, and it helps with pain. It can sort of help with the pain around the area and reduce reinfection or infection. So it is generally quite good. I prefer chlorhexidine, okay? But like I say, it's personal choice. That's the one that I like, but some people might like benzidamine. That's completely fine. Now, moving on to the next over-the-counter treatment. This one is a gel that you apply on the canker sore. This one is a gel containing choline salicylate, okay? There's loads of different brands that have this. Choline salicylate is really good at reducing the inflammation and pain in the area, so it's good at doing that. Please do remember though, it can't be given to children under the age of 16. However, I'm not sure you're going to do this with all these medications that we discussed. You need to speak to your pharmacist before you get any of these medicines, okay? I'm going to say it a few times, okay, in this video, but you need to speak to your pharmacist so they can make sure that you're safe and suitable to take these medicines. I know that over-the-counter treatments, and you might not think they're as strong, but it's really important you do so they can make sure that you're safe and suitable to take it. With any of the medication you've taken already, or even if you're not on any medication, you might have certain allergies to these medications. That's why it's super important you speak to them, and you always read the information leaflet that comes with them. Okay, so I feel like we're getting somewhere now. We spoke about the OTC treatments as well. We spoke about what you can do at home, but the last OTC treatment I want to talk about is probably going to be our most hardcore treatment, okay? So we started down here with the saltwater stuff, and then we've been working our way up with the chlorhexidine and the benzidamine, the choline salicylate. I'd probably put them all at the same level. So saltwater was there, the other ones were there, but this one's the top one, okay? This one's the strongest one, and it is a steroid lozenge, okay? A lozenge is what we call a hard-boiled sweet, for example. I don't think in the US they call them lozenges. So I've had a few comments, I can't speak today. I've had a few comments whenever I say lozenge, and people get really confused what I'm on about, but it's like a hard-boiled sweet that you suck on, basically, okay? So you can get steroid ones of these lozenges that you suck on. You usually suck it in the mouth, and obviously the saliva spreads all over the mouth, and that can be really, really helpful when you've got a few canker sores and it's super painful. You know, I've had patients before that have had so many canker sores in their mouth they can barely open their mouth, and I really feel for them, because it is really, really painful sometimes. Canker sores can be, and when you've got a patient like that, the other treatments just aren't going to touch it, okay? So we usually then go for steroid lozenges that the patient sucks on, and it can be really helpful at reducing the inflammation in the mouth. Please remember though, you will have to speak to your chemist for these. These are available to buy here in the UK. They are licensed to be sold in the chemists in the UK, but I'm not sure about other countries. So again, speak to your chemist, find out more information, and also, most importantly, make sure you're safe to take it. So my next question for you guys is, how are you finding this video so far? I hope you are finding it informative. If you found any of this information helpful so far, please don't forget to click that like button. Like I said, it's going to help the video grow. It's going to help me as well. It makes me feel good when I see more likes that it's helping people around the world. So, now that we've spoke about things that you can do for canker sore treatment or mouthwash treatment, whatever you want to call it, the next thing I want to talk about is lifestyle advice, okay? Because there are things you can do that, one, can help reduce the pain that you're having at the moment, and 2, can help prevent you from getting them again in the future. Especially if you're someone who's prone to getting mouth ulcers or canker sores, whichever you want to call it, then you need to really listen up on this bit, because there might be certain triggers that you keep having that are actually causing it. So let's begin. So moving on to tip number 3, the first thing we're going to talk about is avoiding foods that can irritate the mouth ulcer, okay, or irritate the mouth. So these are foods that are, for example, very, very hot. This is going to irritate it. Very salty foods, again, it's going to irritate it. Acidic foods, okay? Acidic foods can also irritate, and acidic foods, for example, are like citrus fruit. If you're having loads of them or having loads of juices, these can actually bring on mouth ulcers or irritate it, especially if you've got it. Very spicy food, again, it can cause that irritation and make the mouth ulcer worse, or potentially cause it as well. And lastly, if you're having food that is quite coarse in texture, and by that I mean, for example, if you're having like toast, 10 times a day, if you're having 10 slices of toast a day that's been toasted and it's really coarse, sandpapery sort of, that's what you need to think of it like, and it's hitting your mouth and it's hitting the gums and them areas, then that might be aggravating the mouth ulcer if you've already got one, or it might be potentially causing one as well, because that abrasion can potentially then cause a mouth ulcer, if that makes sense. And this applies for other foods as well, like, for example, if you're having crisps all the time, if you're having loads of crisps, again, they're coarse in texture and they can also irritate. Moving on to tip number 4, which is avoiding chewing gum. If you're someone that chews gum all the time, again, there's more of a risk of causing that irritation. You might bite somewhere, you might bite your tongue, and that irritation, because the mouth isn't designed to be constantly moving all day long. So if you're biting something and chewing gum every single day like this, okay, it's just going to cause that irritation more, okay? We need the mouth to rest sometimes. That's why we don't eat all the time either. So if you're thinking to yourself, actually, I have like gum every single day, all the time that I'm awake, I'm chewing on gum, then this might be one of the culprits. Moving on to tip number 5 is avoiding toothpaste that contains sodium lauryl sulfate, okay? We call this SLS for short. Again, this is an irritant and it can be bringing on those mouth ulcers. It can also make it a lot more painful, especially if you've got a mouth ulcer at the moment. So look at your toothpaste. If you've been using a toothpaste for a long time, and you suddenly you've noticed that you actually have been getting these mouth ulcers, these canker sores for a long time, check the ingredients. That could be one of the culprits. Moving on to tip number 6, it's all about eating a healthy, balanced diet. Look, sometimes if you're not having a healthy, balanced diet, it's gonna lead to nutritional deficiencies, it's gonna lead to mineral deficiencies and vitamin deficiencies, and these can sometimes cause mouth ulcers, okay, or canker sores. I'm getting confused now which word I'm gonna use. I'm gonna keep calling it canker sores, but have a look at your diet. If you're someone who's prone to getting canker sores all the time, let your healthcare professional know about this as well. They might arrange some blood tests as well to see exactly what's going on. And if you are thinking to yourself, actually, Abraham, I don't know what I need to do to have a healthy, balanced diet. It's a word that everyone throws at me, but no one ever explains. Well, not to worry, because I do have a video on the topic. And if you want more information on it, I will leave a link up here and in the description below, so feel free to give it a watch. And tip number 7 is all about using a toothbrush with soft bristles, okay? So if you're someone who's using a toothbrush with really hard sort of bristles, again, this can cause that irritation, it can cause that abrasion. If you're someone who brushes their teeth really vigorously and hard and they're whacking their gums with the end of the toothbrush, then that again can cause the mouth ulcers. So I really need you to sort of reflect on these things. Give it a think. Now that you're aware of these sort of things, have a little think next time you're brushing your teeth, or next time you're eating, or next time you're doing these things that we spoke about that can possibly be causing the mouth ulcers. There's some of them you might be able to relate to and make some changes to see if there's any improvements. Okay, so I hope you're finding this information helpful so far. I hope it's really going to help your canker sore. You now know what to do for the treatments. We also now know what to do with the lifestyle stuff and preventative stuff, but we need to go to the most important part of the video, when to seek medical advice. I'm going to have a little box pop up here. Give it a read, but please remember this: if you've had a canker sore and it's lasted more than 3 weeks, so 3 weeks or more, you need to seek medical attention. That's really important, because you need to get checked out what's going on. Also, bear in mind that if you're constantly getting canker sores and it's constantly coming on, or if you've gotten it towards the back of your throat at all, okay, or they're getting bigger, they're getting redder, they're getting really, really painful, any of these kinds of things, also give this bit a read as well. Speak to your healthcare professional. That's the most important thing, because you need to find out what's causing these, okay? That's the most important thing. Now, I would also recommend, if you're someone that gets canker sores now and then as well, speak to your dentist too. Go to your dentist, get a checkup done. When was your last checkup? Are you having checkups every 6 months? If not, you need to go to your dentist so they can give you a good checkup, Find out, because there might be certain things that are causing it, and they can see just by looking at your mouth if there's certain things that they need to fix, if there's something that's rubbing, if there's a bite that's a problem. Any of these, they could potentially be causing the canker sores as well. So it's a really good idea to speak to your dentist too, get them involved as well. And as I mentioned earlier, vitamin deficiencies and mineral deficiencies as well can sometimes cause canker sores. So if you are someone who knows already that you're at high risk of these deficiencies, then again, you need to seek medical attention. Also, please remember, if you've got things like Beckett's disease, or if you've got IBD, and all these sort of symptoms, things that can cause malabsorption, so you're not absorbing vitamins and minerals correctly, again, these can put you at higher risk of getting these canker sores. So if you fall into any of these categories, again, speak to your healthcare professional. Okay, so it looks like we've come to the end of this week's video. I really hope that you found this information helpful. If you've got a canker sore right now, I really hope that these tips are going to help you, so you're going to get well soon, and I really wish you a speedy recovery. Please remember as well, don't forget the red flags that we spoke about. Don't forget about seeking medical attention, because you now know all of it and you know everything you need to know. Please tell your friends, tell your family, tell your loved ones everything that you learned today. And also, if you've got any of your own tips as well, don't forget to leave a comment below, because I'd love to read it, and I'm sure everyone watching this video would love to read it too. And as I always say at the end of every single video, and I can't speak in this week's video for some strange reason, but as I always say, always remember that you're awesome, and I will see you next week. Please don't forget to click that like button. It's going to help the video grow, and it's going to help me feel a bit better, because I'm like, oh yeah, more likes. That was the worst thing I've ever said in my life. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.